COVID-19 is actually the disease that is caused by the organism, which the organism is SARS-CoV-2. So it actually is a coronavirus, and there's coronaviruses that have kind of reared their ugly heads before, but there's coronaviruses that are human coronaviruses, and then there's coronaviruses that come from animals. And we've seen some coronaviruses that come from animals before. The first SARS-CoV-1, which was in 2003, which was, there was about 8,000 cases. And we really haven't seen any cases since 2004 of that one. And then I don't know if you remember MERS, the MERS-CoV, that was a coronavirus. That was in 2012. And we had about 2,400 cases of those, and that still infects humans. And now we have this one, which is SARS-CoV-2. And this is a coronavirus that started with animals. And because it started with animals, we don't have a natural immunity for it. And that's why it hits us so hard. So it started with live animals. Somehow it jumped from animals to humans. And now we're seeing it passed from humans to humans. And so it is, the organism is SARS-CoV-2, and then it now has caused COVID-19, which is the disease. So of course you're seeing that it is easily spread from person to person. It is highly transmissible through droplets, through respiratory droplets.
I work at Sweetwater Sound and do a sales engineer on the phone. I am working. Everything we're doing is working remote right now. Even the tech support team, the only people that are in the building really are security and the warehouse crew. They are actually back in the warehouse trying to do what they can. So they did have to make a lot of changes though, just to make them kind of stay within guidelines. But they actually are happy to be there. So being able to actually have somewhere that's not just unemployment, right, to actually get money in. So it's actually kind of nice for them.
In our hospital, we're here in the Midwest. So because our lifestyles are a little different than what you see in New York City. So New York City, they're very, very dense populations. They use a large amount of public transportation. People are very, very close together. So, you're seeing, many, many, many cases, thousands of cases. Here in the Midwest, we live farther apart. Our land mass, we're farther apart. Our homes are larger. Our homes are farther apart. We generally have private transportation as opposed to private or a public. So we're not seeing the huge numbers like that. However, now we are starting to see our numbers rise.
Right.
So in our hospitals now, we are now starting to see cases come in. And as you know, testing has been pretty slow in our country. So because people can walk around with and be infected and not really have symptoms or have very mild symptoms. And because we're really not testing people, there's fairly strict criteria for testing people.
School has been the biggest lifestyle change because I don't have to show up on campus. Everything's online, and some classes are obviously harder to do in that format, like for learning programs and stuff. So that's been harder to kind of adjust to. And then, and communicating with the teachers as well. Some are a little bit more lax than others. So that's also a little bit harder to remember, like what teachers and what classes are more stricter than others, and what you still have to get done with what's been going on.
So now that I have all the extra free time at home, especially with the wife, we just really do a lot of things with our dogs, go hiking, biking, walking, actually more activity than when we weren't quarantined. But that's kind of really the focus right now, is just being good with each other and, kind of if this goes on longer than it should, just how we're going to keep going with it, So, but it's been good, all things considered. We've had a really fun time together, and we'll keep walking, we'll keep doing all that fun stuff that we like to do that we didn't have the time to do normally, you know, because it's an hour less basically, where I'll be able to, you know, sleep in a little bit more and be able to get up early with her and, you know, kind of be able to plan our days together versus just being completely separate and after work get together, you know. So it's been a good time.